today's topic is analgesics. So what are analgesics? So these are the drugs which are related to the central nervous system. So before going to the definition of analgesics, let us discuss what is pain or analgesia. So pain or analgesia is a discomfort, or else we can say it is an uncomfortable situation where there will be some disturbances in the sensory as well as emotional experiences which are associated with the tissue damage as well. For in simpler words, we can say if there is any tissue damage, then there occurs some sensory responses in the brain and thereby we can feel some discomfort. So this is called pain or analgesia. And what are these analgesics? So analgesics are the drugs which antagonize the pain. So analgesics are the drugs which relieves the pain acting on the central nervous system as well as the peripheral nervous system without affecting the conscious state of the person. So these are the drugs which by acting on central as well as peripheral nervous system, they relieve the pain thereby without affecting any conscious state of that person. So these are called as analgesics. The word analgesics is derived from a Greek word called as an in the sense without, and algos means pain. So these are the drugs, they relieve pain, or else we can say they do not produce any sort of pain. There are types of pain, various types of pain. For examples, the types of pain are superficial pain and deep pain. So what is this? The name itself indicates superficial in the sense where it affects the skin, dermis as well as the mucous membrane. So it is like we can say it is acting on the upper surface of the skin. So it is acting on the upper surface, dermis as well as mucous membrane of the skin, and thereby if there is any damage occurring to these parts, then the response will be fast and thereby the pain occurs. And what is deep pain? So deep pain mostly arises in the muscular tissue as well as bones, joints, blood vessels, etc., which is causing some discomfort inside the body, in the organs which are present inside the body. That is the reason it is having slow response. Let us see what are the pathways which are involved in the pain. So in pain, especially in the mechanism of pain, there are two pathways. One is nociceptive pathway and the other one is neuropathic pathway. So what is this nociceptive pathway? So nociceptive pathway is a pathway where because of the stimulation, potential stimulation of the nociceptive receptors occur. So these are the receptors which when getting stimulated, they cause some harmful to the body. So these receptors on stimulation, they cause some potential stimulus where the stimulus is sent to the brain and thereby some sort of pain is occurring. So this is how the pain occurs in the nociceptive pathway. So in the nociceptive pathway, we can see some odontogenic conditions. So these are the conditions which are affecting in the tooth development. Or else if there is any problem in the mucous membrane of the tooth as well as in the development of the tooth, then this nociception pathway is there. And it is also affecting even the skeletal muscles also. And if we see the neuropathic pathway, so this is a pathway, the name itself indicates neuropathic. So this is a pathway of pain where it is damaging some sort of neurons. So in the central nervous system and peripheral nervous system, if there is any damage occurring to the neurons and there it causes some sort of stimulus created and thereby the pain occurs. So this sort of pain is called as neuropathic pain. And this neuropathic pain, it involves the pain, or else we can say it involves the algesia in the cranial nerves especially. It involves the pain in the cranial nerves and it causes some tooth pain also because of the nerve supply to the oral cavity. It causes some tooth pain and it shows some stomatodynia condition. So what is this? It is like a pain which is caused in the lips, mouth as well as to the tongue. We can say the pain caused in the oral cavity. So this condition is called as stomatodynia and there occurs some trauma, that is a severe pain to the nerve injury. We can say there will be some severe nerve injuries caused in this neuropathic pathway. This is the diagrammatic representation of the nociceptive pathway. Here we can see the thalamus which is present in the brain from where the signals are sent to the brain, from the brain, and here you can see the nociceptive receptors. So on stimulation, or else we can say on stimulation of this nociceptor or nociceptive receptors, because of the potential stimulus sent by the brain, it causes the nociceptive pain. So this is the mechanism of pain. Here is the flow chart. First there will be the tissue damage. So if there is any tissue damage, or else we can say if there is any some sort of injury to a tissue, what happens? So because if there is an injury to the tissue, there are some chemical mediators like bradykinin, serotonin, prostaglandin and potassium ions released in the body. So because on response to this release, there occurs activation or sensitization of the nociceptive receptors. If the activation of nociceptive receptors takes place, it releases a chemical mediator called as substance P. So this is one of the main chemical mediator which is involved in the pain pathway mechanism. And this substance P, what does it do? It acts on the mast cells. So once the mast cells are degranulated, so once the degranulation of the mast cells occurs, thereby these mast cells release histamine. So histamine is the chemical allergen which is secreted released in the body. So on release of the histamine, it causes the excitation of the nociceptive receptors. So once the nociceptive receptors get excited, it leads to pain. Now let us see the drugs which are antagonizing the pain, or else we can say the drugs which relieve the pain. So these are called as analgesics, and these analgesics are classified into two categories, mainly opioid analgesics and non-opioid analgesics. So opioid analgesics include the drugs like narcotics or morphine-like analogs. And non-opioid analgesics include drugs like NSAIDs, that is non-steroidal anti-inflammatory drugs, like aspirin and its analogs. Let us see the classification of opioid analgesics. So these opioid analgesics are further classified into natural opium alkaloids, semi-synthetic opiates and synthetic opiates. So in the natural opium alkaloids, the drugs include morphine and codeine, which are naturally occurring from the plant sources, and semi-synthetic opioids which include diacetylmorphine, oxymorphone as well as folcodeine. So these are the products on some structural changes to the natural products they occur. For example, if we take the diacetylmorphine, so some structural changes in the morphine brings the compound called as diacetylmorphine. So it is neither naturally occurring from the plant as well as it is synthetically derived. So these are the semi-synthetic products which on structural modification of natural compounds are synthesized. And the other one is synthetic opioids like pethidine, fentanyl, methadone, dextropropophine as well as etoheptazine and tramadol. So these are some of the synthetic opioid analgesics. Now let us see the non-opioid analgesics. Non-opioid analgesics include the drugs like non-steroidal anti-inflammatories. So these non-steroidal anti-inflammatories are further classified into non-selective COX inhibitors as well as selective COX inhibitors. COX is nothing but the cyclooxygenase enzyme which is involved in the process of the production pathway of prostaglandins. So cyclooxygenase is an enzyme which is involved in the synthesis of prostaglandins. So these non-selective COX inhibitors, there are two types of COX enzymes, COX-1 as well as COX-2. So COX-1 is the enzyme which is present in the body, as well as COX-2 will be released into the body if there is some sort of inflammatory reactions occurring. So this is a temporary type of enzyme. So these non-selective inhibitors, they either act on COX-1 or COX-2 enzymes. So these drugs include drugs like salicylates, which include aspirin, salicylamide, benorelite as well as diflunisal, and pyrazolone derivatives include phenylbutazone, oxyphenylbutazone, and the other one is propionic acid derivatives include drugs like ibuprofen, naproxen, ketoprofen, phenoprofen, flubiprofen as well as oxaprozin. And indole derivatives like indomethacin and sulindac, anthranic acid derivatives like mefenamic acid as well as flufenamic acid, and aryl acetic acid derivatives include diclofenac and tolmetin. Oxycam derivatives include piroxicam as well as tenoxicam, and pyrrolopyrrole derivatives include the drugs like ketorolac as well as fiprazole. Now we'll see the selective COX inhibitors. So these are the drugs which either act on COX-1 enzyme or COX-2 enzyme. So the COX-2, selective COX-2 inhibitors, in the sense we can say preferentially COX-2 inhibitors. So these are the drugs which may act on COX-2 inhibitors like Nimesulide, meloxicam as well as Nabumetone, as well as the selective COX-2 inhibitors include drugs like Valdecoxib, Celecoxib and Rofecoxib. There are few drugs, there are few anti-inflammatory drugs which are having analgesic action, like paraminophenol derivative, that is paracetamol, as well as pyrazolone derivative like metamizole and propionate, and benoxocaine derivatives like nifopam. Let us see in detail the pharmacology of these drugs. So opioid analgesics. So these, here we can see, before entering into the pharmacology of drugs, let us discuss about the opioid receptors. So there are three types of opioid receptors, that is mu receptors, kappa receptors as well as delta receptors. So mu receptors, here we can see some of the tabular format of opioid receptors. These mu receptors are of two types again, mu1 receptor and mu2 receptor. And mu1 receptors are present supraspinal, as well as mu2 receptors are present in the spinal region. And effects. So these mu receptors on stimulation, they show effects like analgesia, respiratory depression, sedation, euphoria, meiosis, physical dependence, loss of gastrointestinal motility. So these are few of the effects which are caused on stimulation of mu receptors. And the agonists include morphine, codeine, fentanyl as well as pentazocin, and the antagonists include cyprodine. And the cyprodine. The other one is kappa receptor. So these kappa receptors are also again divided into two types, that is K1 as well as K2 receptors. So K1 receptors are present in spinal region and K2 receptors are present in the supraspinal region, and these shows effects like spinal analgesia as well as dysphoria, sedation, psychomimetic action, which exactly mimic the actions of the central nervous system, and physical dependence. And the agonists include pentazocin and antagonists include the norbinyl-torphamine. So the other one is delta receptors. These delta receptors are also of two types again, delta 1 and delta 2. Delta 1 receptors are present in the spinal region and delta 2 receptors are present in the supraspinal region. And the effects of stimulation of these delta receptors include spinal analgesia, affective behavior, as well as the respiratory depression and reduced gastrointestinal motility. And the agonists include deltorphins and cannabinoid derivatives like cannabidiol, and the antagonists include buprenorphine and naltrexone. Now let us see the mechanism of action of these opioid analgesics. So any opioid analgesics show the mechanism of action by binding to the opioid receptors, they exert their action. Here we can see the pictorial representation. Here at the neuronal cleft or else at the synaptic cleft, from this storage vesicles, these opioid analgesics, or we can say the drugs, once they enter into the body, they aid in the release of the neurotransmitter, and thereby this neurotransmitter go and bind to the opioid receptors. Here the mu receptors are present, and mu receptors on activation, they produce the effects. So these opioid receptors have various effects. For example, on respiratory system, they show respiratory depression, as well as in the gastrointestinal tract, they show increased gastric intestinal motility. So they are having excitatory effects as well as inhibitory effects. So all these effects are shown on the neurotransmitter binding to the opioid receptors present at the synaptic cleft. Now let us see the pharmacology of individual drugs. So morphine. So morphine is a drug which is obtained from the plant called as Papaver somniferum, and this is an opium alkaloid. So this is an alkaloid part of the plant, and the plant is Papaver somniferum, and morphine is generally present in either in the sulfate form or else it is present in the hydrochloride form. So the individual form is not that active, either it is present along with the sulfate or else it is present along with the hydrochloride. And the structure of morphine include an alkaloid called as isoquinone. So in the structure, if we see the structure, the isoquinone alkaloid derivative is present, which is one of the main active form of morphine. So because of this alkaloid only, the morphine is active. And the solutions of morphine, the solutions which are prepared from the morphine, they are sterilized at 98 to 100 temperature for about 30 minutes with the bactericide. Here we can see the structure of morphine. Here the group, or else we can say the carbon atoms containing oxygen ring, as well as the carbon atoms containing the double bond like C15 from C6, C7, C15, C8, C16, C14, the ring which is present at this area. So this is called as isoquinone alkaloidal ring. So because of this ring only morphine is active. So if there is any structural changes in the morphine, then morphine analogues are formed. Now let us see the analgesic action of this morphine. So morphine, it is naturally occurring plant and it is a very powerful analgesic. So it shows analgesic action and it is the most potent analgesia. But there is only one disadvantage with the morphine, is that it is the drug of abuse. In the sense, we can say the person gets addicted to the drug very easily, and it relieves the pain by acting specially in the central nervous system function. So it is an opioid analgesic which is acting specially in the central nervous system. So the pain occurs both in peripheral as well as central nervous system, but this morphine, it is acting on the CNS rather than the peripheral nervous system, and it is on large doses. This morphine, mostly it has to be given in the large doses only. On small doses, it is not that potent or it is not that active. So because of increase in the doses only, it causes the addiction. And if there is any increase in the dose of morphine, it may lead to severe adverse conditions, like there is a threshold limit. So we can say the morphine is a narrow therapeutic index drug. So the narrow therapeutic index is a margin where the drug shows its effect. So if the dose of the drug either decreases, the therapeutic index will show nullified effect, and if the dose increases beyond this therapeutic index, it shows adverse effects. So morphine is such a drug which is having narrow therapeutic index. So on increase in the doses, we have to be very careful regarding the adverse effects of the morphine, and it does not remove pain completely. So morphine, it never, on administration, it never remove pain completely. It just, we can just tolerate the pain to some extent. So now let us see the uses of morphine. So morphine, as we have discussed, it is a potent analgesic. It shows a potent analgesia or pain relieving action. Along with that, it also relieves the pain in myocardial infarction condition. So as myocardial infarction is a state where the myocardial tissue is replaced by the fibrous tissue. In that condition, there occurs pain in the heart. So this sort of pain can be relieved by morphine, along with the pain which is caused by the in the burns, fractures, as well as the bones, if there is any pain in the bones, and these all pains are relieved by the morphine, and it is administered through intravenous route. It is never given through oral route. So it is preferably given through IV route, and it is used to reduce even the post-operative pain. So after the surgery, if the pain which is occurred after the surgery, that can be relieved through morphine, and on large doses, on increase in the doses, it shows the sedative effect. So on increase in the doses, this morphine is having sedation. The person feels drowsiness and he may feel sleepy. And it is used as a pre-medication for surgery. So for surgery, it is given on hand before surgery. Let us see the disadvantages of morphine. So this morphine is, as I told you, it causes drug of addiction because of its euphoric activity. So euphoric activity is, in the sense, euphoria is a condition where the person feels pleasure on having the substance. So it is a condition where, for example, if you say morphine, so on giving morphine to the person, he feels some sort of pleasure and he lives in his own world. So this sort of condition is called as euphoria. On morphine, on long-term usage, or else we can say on chronic usage of morphine, it causes drug of addiction, and the person cannot withdraw from the drug. So all of a sudden, if there is any withdrawal of morphine, it causes withdrawal syndromes leading to severe side effects, and it is invaluable in the treatment of pulmonary edema. So it is not that useful on treating of the pulmonary edema conditions, and on overdoses it may cause poisoning. As I told you, it is a narrow therapeutic index drug. Beyond its therapeutic index, if it is given, it leads to the morphine poisoning. Let's see the adverse effects of morphine. So adverse effects, it causes adverse effects like there will be the dryness of the mouth, and there occurs mental clouding. There will be some sort of mental disturbances occurring in the person, and dysphoria. There will be vomiting, headache, fatigue, constipation, allergic reactions, and bronchoconstriction. There will be constriction in the bronchioles. And here is a pictorial representation where on reaction to the morphine, histamine is released in the body, and because of the release of histamine, there occurs a red coloration of veins. These morphine should be contraindicated in head injuries. So when there is any head injury, this morphine should not be given as it specifically acts on the central nervous system. And during pregnancy, for pregnant women, this morphine is not recommended. And if there is any pulmonary dysfunction, or else we can say if there is any impairment in the pulmonary region, then also morphine is not recommended. That is the reason it is invaluable in pulmonary edema. In the sense, it's not that useful in treating pulmonary edema, and it should not be even given if a person is having hepatic or renal failure. The other drug is codeine. So codeine is also a naturally occurring plant alkaloid, and this is a white crystalline powder. So it looks crystals. If we see codeine is white in color, and it looks in the form of crystals, and it is sparingly soluble in water. So if we put codeine in water, it does not get solubilized so easily. It's just partly soluble. Only few % of the codeine is soluble. Remaining part of, or else the remaining, whatever the leftover is there, it remains insoluble, as well we can say it remains as such, and it is bitter in taste. So if we taste that, it will be very bitter. We can't taste it. And less potent analgesic when compared to morphine. So morphine is a potent analgesic. So when compared to morphine, it is having less analgesic action, but it is well absorbed when given orally. So morphine is mostly preferred through IV route rather than the oral route, but codeine is preferably given through oral route because of its better absorption. And this is about codeine, and there are the other synthetic analogues like the synthetic analogues of morphine. So this morphine if there is any structural changes, or else we can say synthetically morphine derivatives are prepared, and this include the drugs like pethidine as well as methadone. If we see pethidine is also a white crystalline substance. It is in the form of crystals, and it is very bitter in taste, as well as it forms salts with acid. So if this pethidine, when it is reacting with any acids like hydrochloric acid as well as sulfuric acid, any sort of acid, then it forms the salts of acid. So this is not preferably given in the acidic media, and its action is similar to morphine. So it shows the same analgesic action to morphine. All act on the opioid receptors itself, and it is powerful analgesic as morphine. As it is a morphine substitute, so it is a better, we can say it is a potent analgesic when compared to morphine itself, and it is having very short duration of action. So on giving to the body, or else we can say when it is administered into the body, it shows little delayed onset of action, but the duration of action by which the drug is showing its by which the drug is exerting its actions, that is very short, and it is used in respiratory depressants like morphine. So on respiratory, if there is any respiratory depression, so this pethidine is used, and it is used even to treat shock, as well as it is replacing morphine in the sense if there is any pain caused because of the myocardial infarction situation. So if there is any myocardial infarction pain, then the morphine is replaced by the pethidine because of the better analgesic action than morphine. The other drug is methadone. So methadone is a synthetic compound, and it is slightly potent than morphine. So when compared to morphine, methadone is having better analgesic action, and it is available in the hydrochloride form. So methadone is mostly available, it's not available alone, always it is available in the hydrochloride form like morphine, and it is available in the form of tablets about 5 to 10 mg dose, as well as it is also available in the injection form most. So that is the reason this methadone is preferably given either through oral route or IV route, and it is a racemic mixture. So racemic mixture in the sense it contains both levo as well as trans forms. So levo form and trans form. For example, if we take cetirizine, so cetirizine is a drug which is having some sort of sedation effect. So on conversion of cetirizine to levo form, so it is having some sort of, or else we can say it becomes non-sedative, or else the levo form of cetirizine is having non-sedation effect. So in the same way, this methadone the methadone preparation, it is containing both cis form as well as trans form, or as we can say levo form as well as trans form, where because of the racemic mixture it is showing better action when compared to morphine, and it is used as a substitute for both morphine as well as pethidine as well, and it relieves even the visceral pain also. If there is any pain caused to the visceral areas, then it relieves the visceral pain, and it is used as a respiratory depressant. The other synthetic analog is morphinone. So morphinone is a synthetic analog of morphine. Some structural changes in the morphine brings the morphinone, and the example of morphinone compound is livorphenol. So livorphenol is such a drug which is morphinone analog, and it is more potent than morphine, and as when rather than morphine, this is better absorbed orally. The other one is Benzomorphan. So these are all the analogues of morphine. So Benzomorphan is a potent, we can say it is a potent analgesic when compared to morphine, as these all are the structural changes of morphine. They are showing better action than morphine, and this is a synthetic drug. It is synthesized chemically, and it is used it is mostly given through IM route, that is intramuscular route, in the dose of about 2 to 3 mg. Let us see the non-opioid analgesics. So non-opioid analgesics are the drugs like NSAIDs, that is non-steroidal anti-inflammatory drugs. So these are the drugs which are not acting on the opioid receptor. So they are having some other mechanism in relieving the pain. So let us discuss the pharmacology of these non-opioid analgesics. So NSAIDs, the word itself indicates non-steroidal anti-inflammatory drugs. So these are the drugs which can reduce the fever by suppressing the inflammation. So on inflammatory reactions, it causes some pain and fever in the body. So this sort of conditions are suppressed by these NSAIDs. Here is the pictorial representation. Here from the diacylglycerol or phospholipids of the plasma membrane, it releases the substance called as arachidonic acid. So arachidonic acid is a 20 carbon atom polyunsaturated fatty acid. On the action of phospholipase C or phospholipase A2 on phospholipids, arachidonic acid is released from the plasma membrane, and it undergoes two pathways. So one is cyclooxygenase pathway and the other one is lipooxygenase pathway. Cyclooxygenase is nothing but COX pathway. So here are the two enzymes, COX-1 as well as COX-2 enzymes. So from this cyclooxygenase pathway, the prostaglandins are synthesized, as well as from lipooxygenase pathway, the leukotrienes are synthesized. So here these prostaglandins, once they are getting synthesized, they cause some inflammatory reactions in the body. So here these NSAIDs, they suppress, or else we can say they inhibit the COX enzyme, that is cyclooxygenase enzyme, thereby preventing the synthesis of prostaglandins. So once the prostaglandins are not synthesized, then there occurs no inflammatory reactions, whereby they are showing suppressing effect. Let us see the pharmacology of individual drugs. So the first drug include the aspirin. These are the non-selective COX inhibitors. So aspirin is an acetyl salicylic acid. So if we see here is the structure of aspirin. So it is containing a benzene ring, and thereby it is containing the COOH group. That is the salicylic acid. It is the carboxylic, one of the carboxylic acid derivative. The pharmacological actions of aspirin include, it shows the analgesic, antipyretic and anti-inflammatory. So this aspirin has analgesic action, it is relieving the pain as well as it is showing antipyretic effect. Antipyretics are the drugs which reduce the fever as well as anti-inflammatory. Anti-inflammatory drugs are those which suppresses the inflammatory reactions occurring in the body. This aspirin, it is having the effects on metabolism, like it shows a decreased plasma sugar levels, that is plasma glucose levels, and at the same time it even reduces the plasma free fatty acids as well as cholesterol levels. So if the metabolism is occurring, then on action of this aspirin, the cholesterol as well as fatty acid and glucose levels are reduced. So if they are reduced to the normal, then there is no problem, but if these levels are reduced than its normal, then it causes some decrease of these substances. And on respiration, it shows hyperventilation in salicylate poisoning. So in salicylate poisoning, this aspirin is mostly recommended, and it causes hyperventilation situation in salicylic acid, in salicylate poisoning. It shows the in the sense, this aspirin, when it is given as it is an acid, it shows it is balancing the alkaline condition of the respiratory system. So in the respiratory system, the alkaline media, because of the pleural fluid present in the respiratory system, so this aspirin, it is balancing the alkaline media as well as thereby it is showing balanced effect of this respiratory alkalosis condition. Thereby acid balance is made by this aspirin. And on CVS, that is cardiovascular system, it is showing the effect of vasodilation. So this aspirin, it causes dilatation because as it is inhibiting the prostaglandins on CVS shows vasoconstriction. So as this aspirin is inhibiting the action of prostaglandins, inhibiting the synthesis of prostaglandins, it is showing the quite opposite effect of PGs, that is vasodilatation, and it is increasing the cardiac output. And on GIT, the gastrointestinal tract, it is used in epigastric distress as well as nausea and vomiting. So this aspirin, what does it do? It induces it stimulates the parietal cells to secrete acid. So here this GIT, it causes some epigastric distress, it causes some stress in the gastrointestinal region, and it sometimes causes nausea and vomiting, and it prolongs the bleeding time. So it is the time where the bleeding, or as we can say, it is the time taken for the blood to stop bleeding. So this bleeding time can be prolonged. So because of the bleeding time, there will be hemorrhage, or as we can say, excessive loss of blood. What are the adverse effects of aspirin? So the aspirin has adverse effects like nausea, vomiting. These are the common adverse effects. And it causes epigastric distress, and it increases the blood loss in the stools, as it is having the effect of as it is prolonging the bleeding time. So there occurs blood loss, and this blood is lost through stools, and in the GI, that is gastrointestinal region, it is showing epigastric distress as well as nausea and vomiting. And sometimes it may causes rashes as well as urticaria, rhinorrhea. Rhinorrhea is a condition where there will be running nose, and angioedema. There will be inflammation in the we can say there will be inflammation in the subcutaneous region as well as dermis of the skin. If there is any inflammation, for example, if the inflammation occurs in the subcutaneous region of the eyes, then the eyes will be closed, and thereby the person's vision is not clear, or as we can say, the person can't see itself. So angioedema is the inflammation caused because to the dermis of the skin as well as subcutaneous region of the skin, and it leads to asthma and anaphylactoid reaction. So these are some sort of allergic reactions occurring in the body. On increase in the dose, in the sense, it's on increase in the doses, it causes salicylism. In the sense, it shows some symptoms like it causes dizziness, vertigo, impairment of hearing and vision, the person can't hear and see properly, excitement, there will be mental confusion, hyperventilation, and electrolyte imbalances occurs in the salicylate poisoning. And acute salicylate poisoning, so in acute salicylate poisoning, this mostly occurs In the sense, we can say this acute salicylate poisoning is occurring because of the aspirin at the dose of 15 to 30 grams in the adults. So this, if the dose exceeds than 15 to 30 grams in the adults, it causes acute salicylate poisoning. And even this dose is lowered in children. Even if the dose is below 15 to 30 mg also, 15 to 30 grams also, in children it is causing salicylate poisoning. See, here is the pictorial representation of side effects of aspirin. It shows the ringing sound. There will be some sort of ringing sound in the ears, and thereby the person can't hear properly. There will be wheezing sound. In the sense, there will be some sort of, we can say, whistle-like sound occurring while the person is exhaling as well as inhaling. And there will be fast heartbeat, and there will be bright red blood stools, and there will be bloody vomit also. So these are few of the side effects which are occurring because of aspirin. Let us see the uses of aspirin. So this aspirin is a potent analgesic. It shows antipyretic effect. It reduces fever, and it is used even in acute rheumatoid fever. So rheumatoid fever is a condition which is caused in the rheumatoid arthritis. So here in rheumatic fever also this aspirin is used, and rheumatoid arthritis condition, osteoarthritis, and post-myocardial infarction. So after the myocardial infarction, if there is any pain caused because of the myocardial infarction, that can be reduced. And patent ductus arteriosus condition. So this is a condition where there will be, we can say there will be some sort of pain, there will be some sort of problem in the heart development. So in this condition also aspirin is used, and it is used in prevention of colon cancer, and it is used in Bartter's syndrome. This aspirin should be contraindicated in peptic ulcer because this aspirin, it potentiates the release of hydrochloric acid. So that is the reason if excessive acid is released in peptic ulcer condition, it may worsen the situation. So that is the reason they should be contraindicated in peptic ulcer. And bleeding tendencies, in the bleeding tendencies also this aspirin should be contraindicated. And children suffering with chickenpox or influenza, chronic liver disease, diabetes, pregnancy, breastfeeding mothers, as well as in the G6PD deficient individuals. So G6PD, that is glucose 6-phosphate dehydrogenase. So this is an enzyme which is aiding in the proper functioning of the red blood cells. So if there is any G6PD deficiency, there occurs impairment of red blood cells. So these aspirin, as it increases the bleeding time, there will be heavy blood loss. And if there is any, the person who is suffering with this G6PD deficiency, and if we give aspirin, then it may worsen that condition. The dose of aspirin is mostly recommended to give about 0.3 to 0.6 grams for every 4 to 6 hours orally. So these aspirin are mostly given in the form of tablets, and they are given in the dose of 0.3 to 0.6 grams, and it should be given for every 4 to 6 hours. And the available preparations of aspirin are: aspirin is available in the 350 mg tablet, Disprin, which is available in the 350 mg tablet, and Colsprin 100, 325 as well as 650 mg tablet, and Ecosprin 75, 150 and 325 mg tablets. So these are all the marketed formulations of aspirin. So these are few of the symptoms of aspirin overdose. So if there is any increase in the dose of aspirin, it causes restlessness, hallucinations, drowsiness, loss of consciousness. The person will lose consciousness, and there will be seizures also occurring, and the seizures can't be controllable, and there will be double vision. The person will see the objects all in a double, and thereby there will be burning throat pain. There will be severe pain in the throat as it causes burning sensation, and there will be vomiting as well as decreased urination. So dental considerations, while we can say in the dental situations, or else we can say while giving the dental treatment, what are the precautions we have to take, or else what are the considerations we have to make into consider while giving aspirin therapy. So we have to note some sort of features like BT, that is bleeding time, CT, clotting time, PT, prothrombin time, and INR, that is international normalized ratio. So the international normalized ratio is a measure where it is used in the laboratory conditions in order to see the time taken for the blood to clot. So all these parameters are to be considered while giving aspirin therapy if a patient or else if a person consults a dentist. The other drug is Indomethacin. So Indomethacin is a drug which contains indole alkaloid. So in its structure it is containing indole alkaloid. Because of this indole alkaloid only it is showing the analgesic effect, and it is a potent inhibitor of PG synthesis. That is, it is a potent inhibitor of the prostaglandin synthesis. It very good, I mean, in the sense it preferably inhibits the COX enzyme, and thereby it suppresses the neutrophil motility. So this PG synthesis, the neutrophil motility will be increased, whereby whereby more inflammatory reactions are occurring in the body. So this Indomethacin, it inhibits the PG synthesis, thereby decreasing the neutrophil motility, and it is well absorbed orally. So it is mostly given through oral route, and it is well absorbed through oral route, and the T half of this Indomethacin is about 2 to 5 hours. The dose of Indomethacin is mostly given at the dose of 25 to 50 mg BD/QID. BD in the sense bis in dice, that is twice a day, and QID, that is quarter in dice, that is 4 times a day. So based on the dose, either we have to give twice a day or 4 times a day, and it is commercially available in the form of Indocin, Indocap as well as Indoflam at the doses of 25 and 75 mg tablets. What are the adverse effects of Indomethacin? So if there is any excessive dose of this Indomethacin, it shows adverse effects like it causes gastric irritation, nausea, vomiting, as well as anorexia. The person, anorexia is a condition where there will be loss of appetite, and thereby the person becomes lean or thin, and it causes frontal headache. There will be severe pain in the frontal region, dizziness, ataxia. The person will not be attached socially, and mental confusion, depression, and psychosis. And there will be leukopenia. There will be decreased leukocyte count and rashes, and there will be increased risk of bleeding. So these are all the side effects which are occurred on the overdose of Indomethacin. This Indomethacin should be contraindicated in the persons like machinery operators, so who are operating machines. So this Indomethacin should be not given because it causes dizziness, and thereby drivers who are driving, and psychiatric patients because it causes psychosis on overdose. So it may worsen the condition if we give in psychiatric patients, and epilepticus because on overdose it causes seizures, and kidney disease, pregnant women and children. So in all these people, this Indomethacin is contraindicated. The other drug is Ibuprofen. So Ibuprofen is a propionic acid derivative. So in the structure it contains propionic acid, which is the main structure, or else we can say that which is the main part of analgesic action. And the adverse effects of Indomethacin include the gastric discomfort. There will be some sort of discomfort in the gastric region. Because of that, it may cause the nausea and vomiting, and there will be common side effects like headache, dizziness, and there will be blurred vision. The person can't see properly, and it causes tinnitus and depression. Tinnitus is a condition where we can see some sort of ringing sounds we can hear in the ear. So there will be some sort of ringing sounds audible in the ear, and this should be avoided in pregnant women, peptic ulcer conditions, as well as asthmatic patients. So these all non-opioid analgesics, they act only in one way, by inhibiting the COX enzyme. So these all are non-selective COX inhibitors. And the uses of this Indomethacin is that it is used in analgesia, it is used in antipyretic, as well as it is used in rheumatoid arthritis, to relieve the pain in rheumatoid arthritis, or to relieve the fever in rheumatoid arthritis and osteoarthritis and musculoskeletal disorders, as well as if there is some sort of injuries to the soft tissues. So if there is any injuries to the smooth muscle or soft tissues, or fractures or even in vasectomy as well as tooth extraction. So in all these conditions, this indomethacin is used, and it is used in post-mortem as well as post-operatively in order to suppress swelling and inflammation. So after the post-mortem as well as the post-operatives, if there is any inflammation or swelling, so this indomethacin is mostly preferable. It is given in the dose of 400 to 800 mg TDS, that is thrice a day, or as thrice in dice. So this is mostly given in 3 times a day, and it is commercially available as Ibuprofen, Mflam, and Ibuprofen as well as Ibuprofen. So these 3 are given at the dose of 200, 400 and 600 mg tablets, and Ibuprofen is given in the dose of about 100 mg, 400 mg tablet. The other one is mefenamic acid. So mefenamic acid is an anthranylic acid derivative. So it contains the anthranylic acid in its structure, and it causes the common adverse effects like diarrhea, there will be skin rashes and dizziness, and on severe conditions it may causes CNS manifestations. There will be some sort of disturbances or fluctuations occurring in the functioning of central nervous system, and it is also given through oral route, and it is well absorbed through orally, and the T half of this drug is about 2 to 4 hours, and it is mostly used as analgesic mainly in the muscle and joint pain. So in the muscle and joint pain it is used to show the analgesic effect, and it is also used to relieve the pain in soft tissues, and it is used in rheumatoid and osteoarthritis also. And it is given in the dose of 250 to 500 mg thrice a day, and it is commercially available as Medol or Meftol at the dose of 250 to 500 mg tablet. The other one is Diclofenac sodium. So this diclofenac is always in the form of sodium, or as we can say it is always formulated as the sodium salt. And this diclofenac is an aryl acetic acid derivative, and it is also given through either oral route as well as through IV route also. This diclofenac is available in the tablet form as well as injection form, and the plasma T half of this drug is about 2 hours. And it shows adverse effects like epigastric pain. So in the epigastric region there will be severe pain, and there will be nausea, headache, dizziness and rashes, and it is used to relieve the analgesic action in rheumatoid arthritis as well as ankylosing spondylitis. This is a condition where there will be inflammation to the spinal cord, and post-traumatic as well as post-inflammatory conditions. It is given in the dose of 50 mg thrice a day, and 75 mg is given through IM route. So if it is given through oral route, it is given in the dose of 50 mg thrice a day than by 2 times a day, that is bis in dice. So mostly 3 times a day is more potent when compared to 2 times a day, and if it is given through intramuscular route, it is given in the dose of 75 mg, and it is commercially available as Voveron, Diclofenac and Mobonac in 50 mg tablets as well as Diclomax in the dose of 25 to 50 mg tablets. The other drug is Piroxicam. So this Piroxicam is an oxycam derivative, and this is a long-acting potent NSAID. So with this Piroxicam, it is having longer duration of action. So it is showing its analgesic as well as anti-inflammatory effect for longer period of time, and thereby it is very effective. And it is showing a good analgesic as well as antipyretic effect, and it is metabolized in the liver. So the metabolism of this Piroxicam occurs in the liver, and it is excreted in the urine as well as bile. So in the bile as well as urine in form of salts, it is excreted, and the plasma T half of this drug is about 2 days, that is 48 hours. And the side effects of this drug include heartburn. So what does it do? It causes some sort of burning sensation in the heart, and sometimes it causes nausea and anorexia also. And it is used as analgesic for only short period of time, because the plasma T half of this drug is about for 48 hours. So if it remains in the blood for about 48 hours, it may cause severe adverse effects as analgesia. So that is the reason this analgesia is given for shorter duration. If there is any analgesia for short duration, this drug is mostly preferable, and it is also given in rheumatoid and osteoarthritis, ankylosing spondylitis, acute gout. So gout is a condition where there will be deposition of uric acid crystals at the synovial joints. So this in the acute gout it is given, and it is given in the musculoskeletal injuries as well as dysmenorrhea. And it is given in the dose of 20 mg twice a day, and but this twice a day, once for example, if we are giving drug today, then after 2 days another dose of drug should be given, because it takes 2 days for the drug to get eliminated out of the body. So that is the reason it is given twice a day, but after the other dose is given 2 days after the first dose, and it is commercially available as Dolonex, Pyrox and Piroxicam in the form of, or else you can say in the dose of 10 to 20 mg capsules. It is not given in the tablet form, but it is formulated as capsulated form. The other one is Ketorolac. So Ketorolac is a pyrrolopyrrole acid derivative. So this is a pyrrolopyrrole. Pyrrole is a 5-membered ring structure. So it contains both 2 pyrrole rings. Thereby it is forming the structure for the analgesic action. And it is a potent analgesic action. So when compared to anti-inflammatory action, it is a better analgesic. And this drug is rapidly absorbed when it is given through oral as well as intramuscular route. And the plasma T-off of this drug is about 5 to 7 hours. The adverse effects of Ketorolac include nausea, abdominal pain, dyspepsia, there will be discomfort or some sort of gastric intestinal disturbances, and ulceration, loose stools, we can say diarrhea, drowsiness, headache, dizziness, there will be nervousness, and there will be pain as well as fluid retention. So because of fluid retention, thereby there causes inflammation, and it is not given to patient on anticoagulants. So if a person is taking anticoagulants, this Ketorolac is strictly contraindicated. The uses of this drug, it is mostly used in post-operative as well as acute musculoskeletal pain. So after the post-operative, after the operation, there is any pain, and if there is any pain to the skeletal muscle, this Ketorolac is given in the dose of 15 to 30 mg either in the intramuscular route or in the intravenous route for about 4 to 6 hours. And it is used in a renal colic. So if there is any pain in the renal region, then it is also given, and it is used to relieve the pain in migraine and the pain which is caused because of the bony metastasis. So if there is any pain in the bone as well as renal system as well as in the migraine conditions, this Ketorolac is mostly preferable. And it is given in the dose of 10 to 20 mg for every 6 hours, and it is marketed as Ketorol, Zorovan, Ketonov as well as Ketorolac in the dose of 10 mg tablets. The other one is Nimesulide. So Nimesulide is a preferential COX-2 inhibitor. So till now the Ketorolac drugs, all these come under the category of non-selective COX inhibitors. So now we'll see the selective COX inhibitors. This is a preferential COX-2 inhibitors. In the sense, it is having greater affinity to COX inhibitor, COX-2 enzyme when compared to COX-1 enzyme. So this is a preferential COX-2 inhibitor, and it is given through oral route, and on oral route it shows 100% absorption, and it is excreted in the urine, and it shows the plasma T-off of about 2 to 5 hours. And the uses of Nimesulide include, it is used in to relieve the pain in bronchospasm as well as the asthmatic conditions, because see, in the asthmatic conditions or else in the bronchospasm conditions, if there is any tolerance to the aspirin, so if the patients are showing tolerance to the aspirin, then this Nimesulide is mostly preferable, or else we can say we can replace with aspirin, or else we can combine with aspirin or other NSAIDs to show better action. And it is used to relieve the pain, or else we can say it is used to relieve the pain because of the inflammatory reactions caused if there is like sports injuries. So if there is any injury while for these while we play sports, as well as in the sinusitis. So on inflammation of the nose, if there is any pain, or if there is any pain because of the ear, nose and throat disorders, so in all these conditions, so this Nimesulide is mostly preferable as analgesic as well as anti-inflammatory drug. And not only that, it is also having the better clinical use in the dental surgeries. So after the dental surgery, we get this Nimesulide is mostly preferable. And if there is any post-operative pain, osteoarthritis and arthritic fever, in all these conditions, this Nimesulide is preferable. Let us see the adverse effects of Nimesulide. So it is having the adverse effects like epigastralgia. There will be severe gastric disturbances, heartburn, there will be burning sensation in the heart, nausea, loose motions, as well as rash pruritus. There will be, we can say there will be rashes which are occurring in the body, and hematuria as well as fulminant hepatic failure. So on overdoses, it even causes failure of the hepatic system. We can say that it causes liver failure. It is given in the dose of 100 mg twice a day, and it is commercially available as Nimesulide, Nimesulide, Nice, Nobel as well as Nomedol in the doses of 100 mg tablets. The other one is Rofecoxib. So Rofecoxib, Celecoxib, so these are all the selective COX-2 inhibitors. So they only bind, or as we can say, they only inhibit COX-2 enzyme. So whereas if we see Nimesulide, it inhibits COX-1 as well as COX-2, but it is preferentially COX-2 inhibitor. In the sense, it is having greater affinity to the inhibition of COX-2 enzyme. So this is a selective COX-2 inhibitor, and it is effective in to relieve the pain or inflammation in the osteoarthritis, rheumatoid arthritis as well as dysmenorrhea, and in the dental, post-operative and acute musculoskeletal pain, it is betterly used. This Rofecoxib, it is having the normal adverse effects like the headache as well as dizziness, and there will be some sort of gastric intestinal disturbances. So these gastric intestinal disturbances are mild but not severe, and it is well absorbed orally. So it is mostly given through oral route, and it is well absorbed, and the T-half of this drug is about 17 hours. And it is avoided in the presence of hepatic or renal failure. So if a person is suffering from renal or hepatic failure, if there is any failure of kidney as well as liver, so this Rofecoxib is not preferred. And it is given in the dose of 12.5 to 25 mg once a day. OD is nothing but once a day, and it is commercially available as Rofact, Rofegassic, Rofebax in the dose of 12.5 to 25 mg tablet. The other one is paracetamol. So paracetamol is a para-aminophenolic derivative. This we can say para-aminosalicylic acid derivative, and it is we can say when compared to analgesic action, it is a better antipyretic. So it is showing the antipyretic. It lowers the fever than the pain, and it is well absorbed orally, and the T-half of paracetamol is about 2 to 3 hours, and it is not, we can say it does not cause any tolerance. So we can say this is one of the safest drug, and it causes some common side effects like nausea and vomiting, but on a longer usage or else on chronic usage of paracetamol, it causes hepatotoxicity, and it is having the analgesic neuropathy action. In the sense, it is used in the neuropathic analgesia. But this paracetamol, it may cause salicylate poisoning. So as it is a para-aminosalicylic acid derivative, so on increase in the doses, it may cause salicylic poisoning. So we will see acute paracetamol poisoning. So especially in the small children, this paracetamol, it undergoes metabolic reactions. So few of the metabolic reactions which are occurring in the body are conjugation and glucuronidation. So in children, this paracetamol undergoes glucuronidation reaction, and thereby it releases some sort of metabolic product whereby it is causing salicylate poisoning, and it causes these common side effects like nausea, vomiting, abdominal pain and liver tenderness. And there will be we can say this it is also accompanied, in the sense, on severe conditions, on chronic conditions, it may lead to centralobular hepatic necrosis. In the sense, the hepatic cells, the cells which are present in the liver. So there are Kupffer cells in the liver which regulate the temperature, as well as there are the hepatocytes which are present in the liver. So it causes the damage of all these cells, leading to the liver necrosis, and along with the necrosis it may also cause a renal necrosis, or else we can say it causes the renal failure also. And in the on increase in the dose, it may causes hypoglycemia. It reduces the glucose level than its normal situation, and sometimes it may cause coma also. So if there is any failure to the liver and kidney, as well as if there is any failure, or if there is any failure of liver, kidney, as well as decreased glucose level, it leads to the coma. And after all these, sometimes it may causes jaundice also. So after 2 days of acute poisoning, jaundice can be occurred. So how to treat this salicylate poisoning? So this salicylate poisoning, if there is any, we can say in salicylate poisoning, if there is any vomiting, or else we can say the vomiting occurred in this salicylate poisoning, can be treated by giving the activated charcoal. If there is any vomiting which is caused because of the salicylate poisoning, so that this activated charcoal is preferred. But other than that conditions, the N-acetylcysteine. So N-acetylcysteine in the dose of 150 mg per kg. It is given based on the body weight, and it is given through IV or infusion. In the sense, it is infused through IV for every 20 hours. And alternatively, apart from this N-acetylcysteine, the alternative drug which is alternative dose which is preferred is about 75 mg per kg orally for every 4 to 6 hours, and this dose is given for every 2 to 3 days. What are the uses of this paracetamol? So this paracetamol is mainly used to reduce the fever in osteoarthritis. It is a better antipyretic effect, and it is used to relieve pain in the headache, as well as pain caused because of in the skeletal muscle, and it is much safer than aspirin. So when compared to aspirin, it is having lower side effects, and it does not prolong any bleeding time. So aspirin prolongs bleeding time, but this paracetamol is not prolonging any bleeding time. So when compared to aspirin, this paracetamol is having better effects as antipyretic as well as analgesia, and it is used in any group of people. In the sense, they we can say for example, aspirin is contraindicated in one of the other patients. So if a patient is having some sort of renal failure or heart failure, in these conditions, so aspirin is most not preferably given. But this paracetamol, it can be tolerated in any age groups, or else we can say it is given in any sort of patients. And this is not having any, we can say it is not having any significant drug interaction. So it is not interacting with any drug or food. So it is the safest drug. And the dose of the paracetamol is given about 0.5 to 1 gram twice a day. And in infants, it is given in the dose of 50 mg. For children at the age of 1 to 3 years, it is given about 80 to 160 mg. And for 4 to 8 years age group, it is given in the dose of 240 to 320 mg. And for the age group of 9 to 12 years, it is given in the dose of 300 to 600 mg. And it is commercially available as a well-known tablet called Crocin in the dose of 0.5 to 1 gram tablet. And it is also marketed as Ultragen, Pyrogesic, as well as Calpol in the dose of 500 mg tablet. So what are the synergistic effects of these, we can say, of these combinations? So let us see the synergistic effects of these NSAIDs. So Combiflam is a marketed formulation which is containing the drug of Ibuprofen as well as paracetamol. So this paracetamol, if it is combined with Ibuprofen at the dose of 400 to 325 mg, it is showing synergistic effect. At the same time, the Dolokind plus, so Dolo plus, we can say the Dolo plus, if this is a marketed formulation containing Diclofenac as well as paracetamol in the dose of 100 to 500 mg, and Doclozi plus, which is containing diclofenac sodium and acetaminophen at the dose of 50 to 500 mg, and Diclomol, which is containing diclosodium and acetaminophen in the doses of 50 and 500 mg, as well as Cirazi plus containing diclofenac potassium. It's not containing diclofenac sodium but potassium, and Seratiopeptidase. So seratiopeptidase in the dose of 50 as well as 10 mg, and Ibugesic plus containing Ibuprofen and Paracetamol in the dose of 400 to 325 mg, and Esonac SR plus, which is containing Diclofenac, Paracetamol as well as seratiopeptidase at the doses of 100, 500 and 15 mg. So these are all the combinations of marketed formulations. So these marketed formulations contain these NSAIDs in combination. So these combination drugs are having synergistic effect. So all these are having analgesia, antipyretic and anti-inflammatory effect. So if they are given in combinations, they are showing better results when compared to individual drug therapy. Let us see the topical formulations of NSAIDs. So what are the topical preparations? So it is in the sense, these topical preparations of NSAIDs are mostly given in the conditions of we can say if there is any pain to the joints or muscles. So we see the sprays. So topical preparations are those which are applied externally. So these topical preparations of NSAIDs, we see pain relief sprays. So these sprays are used to relieve the pain in the joints as well as muscles, as well as the osteoarthritis pain or fever, if there are any sprains, sports injury as well as backache. So in all these conditions, these topical NSAIDs are preferable. So now let us see the preparations of these drugs. So diclofenac sodium, what are the topical preparations? So diclofenac sodium 1% gel, in the sense it is containing 1% of the 1% drug out of the total preparation, and it includes the marketed formulation of Voveron Emul gel as well as Diclofenac gel, and Ibuprofen 10% gel, which is marketed as Ribufen gel, and Ketoprofen with in the dose of about 25% gel, which is marketed as Rofecoxib gel, and Nimesulide 1% gel, which is marketed as Nimesulide trans gel, and Piroxicam 0.5% gel, which is marketed as Dolonex gel as well as Minicam gel. So these are few of the preparations, which are few of the topical preparations of NSAIDs. Now let us see what are the indications, or as we can say what are the considerations we have to take while administering or while giving the NSAID therapy for a dentist. So here we have to we have to see few of the considerations like irreversible palpitis, or in apical periodontitis, or else in acute alveolar abscess, infected cyst in sinusitis condition, and after the tooth extraction, as well as dry socket, recurrent ulcers, and agranulositis and cyclic neutropenia. So these are all some of the conditions which we can say these are some of the disorders. So if a patient is having any of these problems, or if any of this disease or disorders, so the dentist have to make sure while giving this NSAID therapy, because either it may show adverse effects or it may potentiate the diseased condition. So what are the general contraindications of these NSAIDs? So these NSAIDs are contraindicated in ulcer conditions, asthma, patients suffering with nasal polyp, that is if there is any inflammation in the nasal cavity, diabetes, gout, influenza, and hypocoagulation state, if there is any the capacity of the coagulation in the body is lowered, and in chronic allergic conditions, chronic liver disease, renal failure, salicylate allergy, because paracetamol can cause salicylate poisoning, breastfeeding mothers as well as pregnancy. So in all these categories, these NSAIDs are strictly contraindicated.